I'm Dr. Mary Papazian, Provost and Senior Vice President for Academic Affairs at Lehman College, and I'm delighted to introduce the work of Lehman and EHAN, the International Health Awareness Network. This remarkable partnership, begun in 2003, has supported the education of women as well as the search for a sustainable peace. Now we are developing a new initiative focused on women's health, aimed at decreasing maternal mortality. Working on this issue and helping the UN achieve its millennial goals are very much in keeping with both Lehman's history and our mission. The UN Security Council held its first meetings on American soil on our campus in 1946. Our namesake, Herbert H. Lehman, a public servant of the highest measure, was the first director of the UN Relief and Rehabilitation Administration. He led the effort after World War II to help more than 50 million refugees. Our college is committed to continuing this legacy. Lehman students come from New York and from more than 90 nations. They are largely women of color, many bi or trilingual, and usually the first in their families to attend college. Often they are either single parents or are responsible for taking care of siblings or elderly relatives. Most also hold part-time or full-time jobs. They, like many in our borough, face daily struggles. More Bronx households are headed by single women than almost anywhere else in the United States. More than 40% of children live below the poverty line, and that figure rises to more than 50% for those living in families headed by women. Disparities in healthcare also exist, especially affecting people of color, that lead to higher rates of morbidity and mortality. Through our faculty research, Lehman today is working to address the ravages of HIV and AIDS in South Africa, the widespread malnutrition caused by vitamin A deficiency, and other global health issues. Through our programs in nursing and the health sciences, we are helping to reshape structural inequities and advance health and well-being of all communities. We look forward to contributing with EHAN in this new area of endeavor.
Hello, my name is Frederick Gilbert. I'm the Executive Director of the Lehman College Foundation Board of Directors. Dr. Sharush Roshan, Founding President of the International Health Awareness Network, or EHAN, has been a member of the Lehman College Foundation Board since 2004. In that time, she has played an instrumental role in advancing Lehman's mission. The college fosters its students' integrity, compassion, creativity, and intellectual curiosity with the goal of preparing them to live successfully in a global environment. Dr. Roshan and EHAN have worked with the Lehman College community over the years to highlight the economic, social, legal, and health inequities endured by so many people, especially women and children in developing nations, and to find lasting solutions. Lehman College and the Lehman College Foundation have been proud partners of EHAN as it continues to promote the education of women and girls, maternal and child health, and economic justice, both on our campus and abroad. The college is now developing a collaborative project with EHAN in the fight against maternal mortality, a midwife training program in conjunction with Lehman's Department of Nursing and Division of Education. This program will produce highly skilled midwives equipped to provide the care so critical to women's health, maternal survival, and the well-being of families and communities.
I am Dr. Sharush Roshan, the founding president of the International Health Awareness Network, known as EHAN. EHAN was conceived in 1985 at the United Nations End of the Decade Conference on Women in Nairobi. Today, I would like to speak about a new initiative to be launched by Lehman College and EHAN to advance global health by reducing maternal mortality. I was a child accompanying my grandmother, the village healer, when I witnessed a young pregnant mother bleeding to her death because there was no ambulance and no road to take her to the nearest hospital. It was then that I decided to be a doctor for women. After 25 years of collaboration between the United Nations and civil society, advocating on behalf of women's issues, the United Nations and its member states made a commitment to 8 Millennium Development Goals by the year 2015. Maternal health is Millennium Goal number 5. Unfortunately, among all the MDGs, we have made the least progress with maternal health. When I started my professional life 45 years ago, maternal mortality was 500,000 per year. In these 45 years, over 20 million women have died from pregnancy-related complications and 400 million have suffered disabilities related to childbirth. When a mother dies, the fabric of the family is torn. The intergenerational wisdom between mother and child is lost. In many countries, pregnant women approach their deliveries with fear of dying or not being able to care for their child because of poverty, homelessness, being a single mother with no family, or sometimes being even without a country. We should be deeply troubled that maternal mortality still is the leading cause of death among women and girls. We know the root causes of maternal mortality are poverty, persistent gender inequalities, lack of education, insufficient access to adequate health services, gender-based violence, harmful traditional practices, lack of economic opportunity, and lack of participation in decision-making. In June of 2009, the United Nations Human Rights Council adopted a historic resolution on maternal mortality, affirming the signatories' commitment to address maternal health. By recognizing safe motherhood as a human right, this resolution should motivate our leaders to mobilize the resources to make motherhood safe for all women. Now that we have made this commitment to maternal health, let us fund and implement the solution. As the clock ticks, another mother has died. This is why we need an immediate solution. Our call to action to save mothers is to train local healthcare providers in obstetric care. Lehman College and EHAN are collaborating to launch an obstetric nursing care training program. We will invite nurses from developing countries to be trained in obstetric care for 1 year so they can save pregnant mothers in their own countries, one life at a time. Nearly 25 years, EHAN and its partners have developed a network of advocates for women's health, including governments, universities, NGOs, and members of civil society. EHAN will draw upon its grassroots experience and its global network to enlist partners and participants in this obstetric nursing care training program. Let us show our love and gratitude for mothers of the human family by ensuring that every mother receives the care she deserves. Every day is Mother's Day. Let us celebrate motherhood by making it safe.